All right, so Dr. Kaufman, please introduce yourself, stating your name, profession, and place of work for us.
Okay, my name is Dr. Jonathan Kaufman, MD. I'm a pediatrician at Pediatric Associates in Barrington.
When did you decide you wanted to pursue this profession?
I made up my decision probably when I was in late middle school or early high school that I wanted to be a pediatrician.
Where did you go to school to get your certification for this profession?
I went to the Chicago Medical School in Illinois, Chicago, Illinois.
Do you have any additional training certifications? If yes, what are they?
I have just training in general pediatrics, that's it.
All right. What do you do? What is a typical day like for you?
Okay. Typical day, if I'm not on call, starts in the office at about 7:30, 7:45. Where I'll do paperwork and get ready to see patients, and then work until anywhere between about 5 and 6 o'clock, depending on the time of the year and how busy the office is. Finish up paperwork and then go home. If I'm on call, then I usually will get up at about 4:30 in the morning, go to the hospital and see patients, and then get to the office. And then after I'm done in the evening, I will basically take phone calls from families that need advice overnight all the way until the next day, until the next working day.
What exactly does it mean by on-call?
So on-call means that we're responsible for any out-of-office types of things that affect our practice. So if there's any patients in the hospital or newborns at the hospital, the on-call person is responsible for seeing them. And then when the office is closed, we're responsible for taking phone calls from parents who need advice before the next working day. And if there's an issue that comes up during the day, during office hours, with somebody who is either in the emergency room or has an outside test that needs action, then the on-call person has to handle that.
All right. That was just an extra question I was wondering.
No, you're fine. Yeah.
All right. What's the worst thing about your job?
What's the what? I'm here. What was your question?
What's the worst thing about your job?
The worst thing is probably just the sometimes handling the overload and the volume, in addition to some of the stresses and pressures that go along with parents and families who get frustrated if their children are sick.
And then, what's the best thing about your job?
The most rewarding part of my job is just watching and families grow and change as their children grow and change and develop over the course of the years, and establishing the relationship with patients and their families.
Awesome. Do you have any experiences that raise the point, that's why I do this job?
Any experiences that what? I didn't hear you, sorry. Can you repeat the question?
Do you have any experiences that raise the point, that's why I do this job?
I think probably the biggest experience is just the satisfaction of watching the families grow, and then those children grow up as patients of mine and their families. They go on to get married and have children, and then come back to bring their children to me. Happens a lot. I've been in practice for 25 years, so it's happening obviously more and more over the last few years. And that's not a specific example, but it's representative of examples of probably the most rewarding part of my practice.
All right. What's the hardest part of your job, morally or ethically?
The hardest part is probably dealing with tragedy, death, severe life-threatening illnesses, severe injuries, life-altering diseases, injuries, or illnesses in patients, and how that obviously affects not only the patient but their family. That's probably the worst part of my job.
What could someone like me do in high school if they were interested in your profession?
The main thing is just to keep an open mind. Don't be afraid to ask. Do stuff like you're doing now. If you know people that are in the profession, whether they be relatives or friends of, relatives of friends or whatever, don't be afraid to ask if you can talk with them and find out as much information about, what their process is. Don't be afraid to ask if you can go into the office and observe them and shadow them at various times. Check with your high school and see if there's any opportunities that they may give you as you go through high school to get more exposure to whatever aspect of medicine you'd be interested in. I think, one of the things, don't be afraid to ask. People take an interest in you that you take an interest in them, and generally speaking, it's a helping profession, so most people are willing to spend the time and talk with you or help you out if you show the interest in what they do.
Awesome. That's all the questions I had. And then one last thing. Is it all right if we share your contact information?
Sure, that's fine.
Awesome. That's all. Thank you.
Okay, all right, take it easy.
You too.
Enjoy the
Bye.
rest of your break. Okay, take care.